You may have heard about this. There's been a lot in the news about SUDEP, sudden unexpected death in epilepsy patients. And it's rare. It tends to happen more in people with epilepsy who continue to have the seizures, this group. And usually the patient just is found dead, like a cardiac arrest or respiratory arrest. And the reasons are not clear. Obviously, this is pretty upsetting because many of these patients are otherwise well, except for their seizures. And it's not a death due to the seizure, like a drowning or an accident. They're just found in bed, dead. So one thought is that this is due to some autonomic instability of the heart rate or breathing due to the abnormal electrical discharge, but it's really unknown. But there's a lot. If you look up SUDEP, you'll see there's a lot. And of course, there are concerned families that are promoting research in this area. Trauma. I had 2 patients who drowned. They went to the YMCA or their health club, and they were in the whirlpool, and they had a seizure and drowned. Another guy drowned. He was walking by the lake on the pier and had a seizure, fell in, and drowned. Because there's an episode, even if they know how to swim, they're unconscious. So drowning. In the old days, burns were a big issue, and probably still here. I've seen it here in the Philippines, where every house had a fire that was burning all the time for cooking or heating. And so if you had a seizure near the fire, you would fall into the fire, and because you're unconscious, you wouldn't pull away and you would get burned. So you see people with very pretty horrible scarring, and it's due to seizures and fire and burn. One of the common sense recommendations to make with someone who has epilepsy is to cook with a microwave, much safer. Suicide is an issue, and we're going to talk about comorbidities. Depression is a big problem. And then pneumonia from aspiration. And status epilepticus is defined as seizures that don't stop. Most seizures are self-limited. Seizure starts, it stops. 30 seconds later, a minute later, it's over. Patient recovers. There are sometimes it doesn't stop. It can go on for minutes or hours with this electrical activity in the brain. Like sustained VTAC, just going on and on and on. And that's bad for the brain. So for those of you who are going to work in the hospital, either as internists or possibly neurologists, I did a study for a year. I worked doing neurology consultations in the hospital. That's what I did. So this is a graph of, you know, at the end of the day, you're very busy all day, and sometimes at the end of the day, you don't even know what you did, except that you were busy. So I said, you know, it'd be interesting to know what I actually did. So I went through all of the claims from the year before to see what were the consults, what were the complaints that they called the neurologists for. All right, let's see. So are there any residents here? Anybody at that level, internal medicine residents? See any hands? Well, the idea is that one of the other doctors would call me, Dr. Wilner, we have a patient, we want a neurologist to see that patient. So what good is a neurologist? Why would you want a neurologist? So it turns out that the #1 reason, that's the big one there, was stroke. So patients who come into the hospital with a stroke, they call the neurologist. Why did the patient have a stroke? Is there anything we should be doing now? The second one, transient ischemic attack, right? So that's stroke-like symptoms, but they resolved on their own. But a good warning that you might have a real stroke later in about 1/3 of those cases. So that was the #2 consult for neurologists in my hospital. The #3 consult was seizure. So seizures in the hospital in people who are acutely ill, very, very common problem. So this is a paper that was just published actually last month on what they call comorbidities. And that is when you see a patient